Good morning and welcome to Radio Friends on Wednesday, June the 19th. Pleasure to have you with us today. We're going to talk about pain today. Back pain, ankle pain, pains all over our body. As we grow older, we tend to come up with pains from time to time. And I've got Jeff Miller with us, MU Healthcare. You're over at the Missouri Orthopaedic Center, right?
Yes.
And
yes,
you
sir.
are a chiropractor.
Yes, I'm a doctor of chiropractic.
Doctor of chiropractor. Okay. What exactly is a doctor of chiropractor?
Well, we're a specialty in healthcare that emphasizes natural health. We do most of our work through manipulating joints, restoring the normal joint motion and alignment to the joints, and then how that relates to the function of the other parts of the body that are affected by the joints. So, and a lot of the focus is on pain relief because of joints are usually when they're not moving well or not working well, they are painful.
Yeah.
And so we focus on pain. 70% or 80% of what we do is mainly with the spine, but we do work on extremities as well. So
how do you know when somebody comes in? Now, I was trying to get some free medical advice from you today, and I was telling you that Dr. Kyle Fiala, he put about 10 or 15 pins in my ankle and put the bone back together, and he did a fantastic job. I mean, I'm pain-free now on that ankle.
Great.
But what I noticed was that before I had that surgery on the ankle, I was walking crooked because of the pain in the ankle. Well, now I got some pain in my buttocks area and my leg. And you said, well, that's probably because of the way you were walking before.
Yes.
Yeah. So what do you do for that?
Well, we're going to test the joints that are involved in your gait, especially your sacroiliac joint when it comes to the spine.
Where is the sacroiliac?
Okay. Most people will point to it and say it's their hip, and they'll put their hand low on their lower back. If you look at a person from behind without a shirt on, they have two dimples just above their buttocks. Right, those dimples are right where those joints are.
That's the sacroiliac.
That's where your sacroiliac joints are.
What is the sacroiliac?
It is a large joint that's kind of the size and shape of your ear. And it's where the wing of your pelvis fits onto the tailbone or the lower aspect of the spine. So it's a pretty good sized joint on both sides.
So what do you do when you say manipulate it? That sounds like it could be painful.
Well, sometimes, but not always.
So how do you twist and turn or what?
There's a variety of ways. You can do it manually, where you put a person on their side and manipulate and actually move the joint by hand, put them in a position, use leverage. It's not a lot of force. People think it's force, but it's actually leverage, which you have to learn to use, and quickness. There doesn't have to be a lot of force to do it, but what you're doing is you're pushing that joint back into its normal range of motion and freeing that joint up to move normally. And once it starts to move better, then everything else will start to improve with that.
Can you tell just by looking at a person if their sacroiliac is out of alignment?
Mainly by watching them walk or how they get up and down from a chair. People with a sacroiliac joint problem will have trouble when they move from a seated to a standing position. They'll also have a certain type of gait they have. You walked with a injured leg before you had the surgery, and afterwards I'm sure you were in a boot or some type of cast, and that's going to alter your gait. And so what happens is you'll other joints will compensate for that, and most of the time sacroiliac joint will be one of the biggest problems.
So what other parts of the body do you realign for pain?
Elbows, just ankles. We see a lot of people for plantar fasciitis, shoulders, knees.
A lot of times, if people have knee problems, can the knee problems be fixed with chiropractic care instead of having surgery? Or
if you catch it early, a lot of times it can, and if it's something that actually is wrong with the joint that manipulation fixes. There's some soft tissue injuries or problems that aren't going to be amenable to that, but if it's in the joint and it's early and there's no excessive damage or wear and tear, then a lot of times manipulation will help.
When somebody comes in and they're in a great deal of pain and you adjust them, is that what it's called, adjusting them?
Adjust or manipulate.
Does it go away immediately and say, oh, I'm pain-free? Or is it something that takes time?
It takes a while. It's more of a process than an event. You get some people, I had one last week that I thought would be a few weeks before she was done, and 2 visits she was doing great. And then there's people come in, you think this is going to be simple, and it turns out to be a lot tougher. But 80% of the people feel relief within a day or so.
Yeah, but the human body, everybody's body is just a little bit different.
Absolutely.
Does it make a difference also with the attitude that a person has? If they feel that this is going to work and they think positive, does it help that it works a lot faster?
I think it does, yes.
Yeah, because our mind and our body and our spirit are all tied in together, isn't it? The way we think is what happens to us. What's the biggest misconception that you feel that people have about going to a chiropractor?
One, that it'll hurt, and it really doesn't. It's very, very easy, and there's a lot of different techniques these days.
So you're telling me that if I come in and you adjust my sacroiliac, it's not going to hurt me at all?
Well, it could be uncomfortable, but it's the difference between hurt and harm. I mean, some things aren't comfortable. Getting a shot's not the most comfortable thing in the world, but, in the long run, it does you a lot of good. It's no permanent damage. But with manipulation nowadays, I mean, the traditional way has always been done by hand, but we have instruments now that help us. We have tables that move special ways that help us. There's a lot of ways. I get older people who've gone to chiropractors for years, and if I don't beat the daylights out of them, they don't think they got their money's worth.
What do you mean, beat the daylights out?
Oh, they just want to be, popped and cracked everywhere, wrestled all over the room, and but that's just what they were used to, because it used to be a lot rougher. But I mean, I have instruments and tables and stuff that help me that you don't even know anything happened to you to be able to get
and
it.
It's fairly quick, huh?
Oh, it's very quick. Yeah.
Okay, all right. If people want more, there are a good group of people over at the MOI, and when you go back, tell Dr. Kyle Fiala that I said hi, and that ankle is doing great.
He's getting better press than I am so far. in this interview, his name's come up more than mine.
You were close. I tell you what, I was in so much pain before I could barely walk, and that was almost like a miracle cure there with what he did for me. I can't say enough about it.
Yeah.
But if people want more information about chiropractic care, they can contact Missouri Orthopaedic.
Yes, sir.
This was eye-opening to me because I had no idea that there was a chiropractor over there.
Yeah, we have 2, and we've been there for 2 years now. And,
okay.
It's kind of a well-kept secret on campus. We've been there for 2 years and been there to provide services, and it's very groundbreaking in a lot of ways. You can't find 10 chiropractors in the world that are, assistants, professors in a medical school.
Yeah.
And
okay.
So
and
it's unusual.
And insurance and Medicare and all insurance covers it. All right, Jeff Miller, thank you so much for coming by from MU Healthcare. For more information, what's the website address?
The website address, I have no idea.
Okay, just go to muhealthcare.muhealth.org, right? Okay. Drop me an email, pepperp@missouri.edu. Bye-bye.